Right. Well, welcome. Welcome back. And welcome if you're listening for the first time. My name is Jody Scholes. I am your instructor for the MBLEX review course. And today we are celebrating over the last 1 to 2 weeks. We've had several of our graduates pass the MBLEX. So excited, so exciting. Congratulations. And also, just know that that is going to be you really soon. Passing, passing. In fact, what I wanted to cover with you today is a little bit about what you can expect from the MBLEX specifically. And the Federation has given us some guidelines on what to expect. Now let me make sure I've got what I need going here. Yep. All right. All right. So welcome back. This is, as you can see, the and from here. Yes, make it pretty, right? So welcome back. We are expanding your career. You are about to take a test and pass a test that will allow you to expand your career. Some of you are practicing massage right now, practicing maybe for donations or for gratuity. But this becoming a licensed massage therapist is what's on your pathway. And that's what we're preparing you for. We're preparing you for passing this exam. Here's what you can expect. The Federation does give us specific examples, specific guidelines on what is on the test. And here's what you can expect. So the anatomy and physiology is about 16%. Kinese is 12%. Pathology, 14%. Benefits and physiological effects of massage, 15%. And you can see the percentages here, but what does that mean? What that means is that of 100 questions on the MBLEX, you'll be getting 11 questions on anatomy and physiology. You'll be getting 12 questions on kinesiology. Client assessment, reassessment, and treating planning, 17 questions. And look, ethic, boundaries, laws, and guidelines to a professional practice, both 16 and 15%, that together, if you add those together, is 31%. That means 31 questions. 3 out of 10 questions are going to be about ethics, business, laws, and then guidelines to a professional practice. So not about anatomy, not about benefits of massage. You're going to get 15 questions on the benefits of massage, but I wanted you to see this so you can have an idea. If you feel like you're getting just a ton of questions about business, you are. If you're getting a ton of questions about ethics or boundaries, that's because 3 out of every 10 questions are going to be in those categories. So I prepare you for the exam systematically. We go through each of these categories, and they're also in the online learning center, much longer classes, about an hour on those classes. Today we're going to focus on anatomy, and we're doing upper body today. So we're doing planes of movement, we're doing joints. Here's the document that I got all of these details from. This is online, and I'll put it in the chat where you can find this. But if you go to the FSMTB and you go .org, you will go, just look for the MBLEX content outline, and you can see this in English or in Spanish. But that's where these numbers are coming from: 11%, 12%, 14%. So, and you can see detailed exactly what is in each category. All right, let's move into some anatomy and physiology. Yes, so we're going to do planes of movement, joints. We're going to cover a couple systems of the body. We're just going to get your brain moving, your brain thinking. All right. So let's take a look at these different regions of the body. These pictures are coming from a book called Trail Guide to the Body. I have permission to use them. Thank you very much to Trail Guide. But some of these will sound familiar and some may be new. So this is our cranial region, our cervical region. So our spine is made up of 3 regions. One of those regions is the cervical region. The second, the middle part of the spine, is the thoracic region. And the lower part of the spine is the lumbar region. Now, we also do have a sacrum, and it could be called the sacral region. But the 3 major parts of the spine are cervical, thoracic, and lumbar. We'll see those here. So we've got where the scapula is, the scapular region. We also have the pelvic region. The pelvic bowl, the pelvic basin, is the pelvic region. So the 2 hips, so not our hip joint, but our iliums, that whole region. We'll see the bones in a few minutes down here, but there's a pelvic region. Let's take a look at the carpal region. So the carpal tunnel, the carpal bones, the dorsal part of the hand. So is the dorsal part of the hand, which part of it is it? So remember, we have a dorsal fin on a dolphin, right? So if we had a dolphin swimming beside us, we'd have the dorsal fin. So it's actually the dorsal side of the hand is what we would call the top of the hand. Careful on that with anatomical position, right? Because our arm is out in anatomical position. So our hands are not on our hips, our hands are out. So dorsal part of the region of the hand. We've got the digital region, the gluteal region, glutes, right? The popliteal region. The popliteal region is behind the knee, also sometimes considered an endangerment site, right? The behind the knee, not the ligaments behind the knee, right? So we've got where the hamstrings come down and attach here on the medial and lateral side. The popliteal region is that soft part behind the knee, and that is considered an endangerment site. No need to have direct pressure in that area. Moving to the opposite side, the right side of your screen here, we've got a facial region, the mandible region, the mandibular, so where the mandible is. This is the clavicle. We'll see a picture of that again in a minute. But the supraclavicle, so here, above supraspinatus, the highest of the rotator cuffs. Moving along to this region, the pectoral region, so where our pectoralis muscles are. Axillary. And so the common name for that axillary region is the armpit, right? The clavicle can also be called the collarbone. The brachial region, cubital region, abdominal region, the inguinal. So right here near that inguinal ligament, the inguinal region refers to the softer part of the belly right here, not at the bottom, because that's more the abdominal region, but the inguinal right here. The pubic region, we've got a femoral region. Again, that refers to the femur, the femoral region. Femur, the long bone of the leg. The antecubital, the antecubital is that part of the inside of your elbow, the antecubital. The cubital region being the elbow, antecubital inside. We've got the palmar region. That makes sense, right? Because it's your palm, the palmar region of the hand. We've got a patellar region, referring to your kneecap, the patella. The curl and the dorsal, we're seeing this again. Dorsal part of the foot is the top part of the foot. And the plantar region, so that bottom part of the foot, right, where you plant your foot, plantar fasciitis, right? So it's itis the inflammation of the fascia of the plantar region. Plantar fasciitis happens on the bottom of the foot. All right. Let's take a look at the planes of movement. I had some questions this week on the YouTube channel of the planes. What are the planes and the planes of movement? So we're going to be covering those. The sagittal plane. This divides the body in half, left to right. So we had the question specifically was about neck flexion, lateral neck flexion. And why that wasn't in the sagittal region, right? Because the sagittal region cuts us in half. So aren't we moving? We are not moving in the sagittal region when we are moving with lateral flexion of the neck. And we'll show you that in just a minute. Think about what other region we might be moving in. Oh, and we're going to talk about it next, the frontal region. So the frontal region, the frontal plane divides us front to back. And so if we had like a plate glass window, and we were standing in between it. And it would allow us to only move our neck, bringing our ear to our shoulder in lateral flexion. That is the plane of movement that we are in. So that's frontal plane. And then we've got the transverse plane that also divides us in half, but top to bottom. Okay? Trunk flexion. Also, if you're sitting in a chair, and you flex your trunk. Keep your butt on the chair and just flex your trunk. This also happens in the frontal plane. I know we want to say frontal is like this, but think about it as two plates of glass. We are moving in that plane, that frontal plane. It divides us, but it also defines the movement. So let's review the directions again. Superior, up, inferior, below. So the shoulder is superior to the knee. The knee is inferior to the shoulder. Cranial and caudal, also referred to. Typically, we see cranial and caudal just in animals, but caudal refers to the tail end. So typically the tail end or the back end. And I see it's going up and down in this picture, and it's saying that the clavicle is cranial to the umbilicus, the belly button. Those we'd use superior and inferior more so. Cranial and caudal is usually the head and the tail. Cranial region being the head, caudal being the butt or the tail. But it can be used in this way too. So anterior and posterior. Anterior is out front, posterior is behind. Medial, the medial midline of the body is medial. So if it is closer to the midline of the body, it is called medial. If it is wider, it is called lateral. Superficial and deep refers typically to pressure, but it can refer to layers of the skin as well. So some layers of the skin are more superficial. That means they're on the top. The epidermis, the dermis, the subdermis, and some are more deep. So deep muscle tissue work, deeper in the skin. We also see proximal and distal. Proximal is closer, higher. Proximal is higher then distal is lower. So we see here the elbow is in anatomical position, right? Because anatomical position is when you're standing and your arm is out beside you, palm is facing forward. The elbow is proximal to the wrist. The wrist is distal to the elbow. Not sure why they're showing you the pectoralis major muscle there, but it's superficial compared to the pectoralis minor, which is deeper. But let's take a look at some movements of the body. All right. So one you don't hear very often, shoulder circumduction. So shoulder circumduction. If this is the anchor point, the shoulder circumducts, almost like a cone shape. That's called circumduction. Lateral flexion of the neck, we reviewed. So ear towards the shoulder. Elevation of the scapula. Elevation up. Depression of the mandible. Depression down. If someone is depressed, they're feeling down, right? Depression of the mandible. Let's talk about supination and pronation. Supination, if you were turning a door handle. So in the picture, it shows turning up. Also soup, right? If we hold soup in our hands, we are supinating our forearm, turning into supination. On the massage table, supination. If they are in supine position, how are they? I see some answers coming in the chat. Oh, thank you, Lynn. I'll get to those questions. All right. Supination, if you are in supine position, you are face up, right, on the table. So you could be holding that soup. Supine position, face up. Supination, hand is moving. Supination of the forearm, turning up. Pronation, down. If we are in prone position, we are face down. Pronation turns our palm down. Pronation of the forearm, turning our palm down. Let me address a couple questions that have come up. Yes, good. Or on the spine, supine on the spine. Yes, you're laying face up. Good. And so what's another name for the transverse plane? I don't know. We can Google that afterwards. And in the sural region, believe that sural region, I rarely even cover that. The sural region is the front of the leg. Is that correct? Let's go back to our planes of movement. The sural, the posterior. Yes, I hardly ever go over this crural or sural just because I've never actually seen it come up and I don't ever use it. But the sural region would be the muscles of the posterior lower leg. All right. Let's do a quick dissection of the spine of the scapula. Here's a picture of the scapula. Here's the spine. This is the left scapula. So here is the left, and we'll see another picture of this later. This is where the shoulder joint happens. This is the infraspinatus fossa. It's the area. A fossa just means a groove or a gap. So fossa just usually means that there's like a little cave. That's a fancy way to say fossa. We got a few more questions coming in. Yes. Okay. Very good. Posterior distal leg. Yep, exactly. Yep, bellies of the gastroc. Yep, exactly. Those are the muscles of the sural region. We would have soleus, gastroc, lower limbs. Movements of the body, back to movement. So we're extending our fingers. We're flexing our fingers, extending and flexing. We'll see those terms again. Adduction and abduction. Add, moving in, adding to the midline of the body, your adductors, adding, moving those legs in. So if you push your knees together, you're adding to the midline of the body, if that makes sense. Abduction, when you abdicate the throne, when you abdicate your position, you're going out, right? Abduction of the legs, of the hips. So keeping your elbow right next to your side, you see medial rotation. So bringing that fist in towards the midline of the body, the medial rotation. The opposite movement, lateral rotation. Lateral rotation of the shoulder, keeping that elbow right in tight, lateral rotation. Likewise, we can talk about rotation of the spine. rotation of the spine, keeping the hips, whether you're standing or sitting, keeping those hips in one place. Go ahead and rotate the spine. And that is just rotation of the spine. It's a twist of the spine. We don't say it's medial or lateral. We say it's left or right. But that's rotation of the spine. Here we see some movements of the foot. And I'm going to go to the next slide because I've labeled them. Inversion of the foot and eversion of the foot. So inversion, most people tend to remember inverting your feet, right? You're turning, it's an easy movement to invert your feet, to turn them in towards each other. In eversion, that's a bit more of a tough movement of the body, and we usually need some help. So eversion of the ankle, eversion of the foot. All right, flexion and extension. So flexion, dorsiflexion. So remember that dorsal fin we talked about on a dolphin. So flexion, dorsiflexion is bringing that foot up, taking it off the gas pedal. Extension, toes pointing, extending the toes. That's extension of the foot. We also have, I can't quite see that. We have protraction and retraction. Not sure if you can see it, but it's covered on my screen. Protraction, we bring the jaw out. Protraction is out. So, and retraction in, bringing that, retracting it in. So we had elevation, depression, protraction, retraction. And then we have deviation of the jaw as well. Sometimes we talk about opposing, in opposition. So that would be movement of the fingers. So movements of the spine and the thorax. Remember, our thorax is our trunk, right? Our thorax, our front here. So we have flexion, moving forward. So flexion of the trunk is moving forward. Let's talk for a minute about body mechanics. It's very important for your body mechanics that you understand when you are bending at the waist versus flexing at the hips, right? Flexing the spine. So I'm going to demonstrate. Isolate your hip bone. Isolate that hip bone, okay? And bend from the hip. We'll flex. Flex from the hip. We're flexing at the hip. Forward flexion. This is extremely important for your body mechanics. You want to flex at the hip. You do not want to bend at the waist. So I'm not moving my hips. I'm bending. Can you see that? Bending at the waist. So if I bend, I put a lot of pressure on my low back. But when I flex at the hip, I can keep my spine straight. That is a big difference with your body mechanics at the massage table. You want to always be flexing at the hip, be forward flexing, movement that comes from that hip joint, keeping the spine straight, not bending at the waist, okay? Extension is the opposite. So if some of you have maybe worked out at the gym and you've got, you're kind of on this like, it's kind of, I call it a horse, but it's probably has a different name, but extending, maybe think about a big round exercise ball. If you're on your belly and you come up, extending your spine. We talked about rotation and lateral flexion as well already. So at the neck, we also have these movements. We've got flexion, we've got extension, we have rotation at the neck, and we have lateral flexion. Good. So muscles in between the ribs. Yes, we've got some elevation and expansion of the ribs when we inhale. Our rib cage expands, right? So we're talking just about the ribs now. Ribs expand during inhalation, and they collapse or decrease, depress. Elevate, they come up and expand. And then they depress. They go down and they collapse. They get closer because there are muscles in between the rib cages. Remember what those muscles are called? Yes, 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 that's right. The muscles in between the rib cage are called the intercostal muscles. Yes, and they live right in here. And you know, sometimes it's really nice to massage those. So say your client is in prone position, they're on their belly, and you're working those rhomboids, you're working those paraspinal muscles. Go ahead and find those ribs. And maybe even just do one at a time or two at a time. Go ahead and go right in between those ribs. Oh, so nice. So nice. It actually allows for a deeper breath. Good idea to just take a deep breath right now. How about that? Take a deep breath wherever you are. Yeah. Know that all is well. All is well. Today, it's like you're back in massage school, right? More movements. All right. Elevation of the shoulder blades, of the scapula, adduction, and so it's also called retraction, moving towards that midline of the body. See how these scapulas here are adducting or retracting. So if you put your arms straight out in front of you, retract, retract, retract your scapulas. You can protract or abduct your scapulas. Throwing a punch brings them out. When we put our arm into 90 degrees, we actually get a little part of our scapula right here. A little part of our scapula comes out. That's called protraction or abduction, away from the midline of the body, abducting. Depression of the scaps, and then we also have upward rotation. And you can see upward rotation brings that, when you bring your shoulder up, upwardly rotates that scapula up and out. And then we have downward rotation as well. You're not going to often see those movements listed. So the glenohumeral joint, we'll see the muscles here in a moment. But we have flexion of the glenohumeral joint. So if I'm standing forward, flexion of the humeral joint, extension of the glenohumeral joint. Glenohumeral, right? So the glenoid fossa and the humerus make up the glenohumeral joint. Flexion, handing off the baton. Extension, hand behind. If you've ever been in a relay race and you're getting the baton handed to you, you may have extended your arm to get that baton passed. Adduction and abduction, again, adding to the midline of the body, abducting. We're going to skip those horizontal abduction and lateral rotation. If you see them, you can figure it out. It's very medial rotation, lateral rotation we've talked about. But we have a lot of material to cover today, so I want to keep you moving through this. And if you want, you can go ahead and rewind and watch it again, or look at it again, or watch a video. Type in horizontal abduction and watch a video. All right. Flexion at the elbow, lifting a weight. Flexion at the elbow. Extension at the elbow, bringing that, extending that. Supination and pronation we've talked about. We've got flexion of the wrist and extension of the wrist. Flexion, extension. We can even, and we're going to talk about the joints, our gliding joints allow us to have adduction and abduction of the hand. Remember, you need to be in anatomical position, right? So when these questions come up about movement, think about the body in anatomical position. So adduction adds to the midline of the body. So the pinky in anatomical position, we're like this, right? So adduction, ADD, added, adduction, abduction. We've talked about our jaw movements. Let's look at the acetabulum and the pelvic girdle. This is a lovely picture here of the pelvic girdle. This is the pelvic basin or the pelvic girdle. And we have anterior tilt, posterior tilt, and lateral tilt. So here's the little red dot that it represents the hip joint. That stays pretty consistent. Here in anterior pelvic, that means this bony landmark, and this bony landmark is called the ASIS. Well, it's actually, that is the anterior superior iliac spine, but that bony landmark, it has a name. In any case, ASIS is the bony landmark we look at right here to determine anterior tilt or posterior tilt. So anterior tilt, butt sticks out. My ASIS anteriorly tilts the pelvis, tilts it forward, soup spilling out of the pelvis. If it was a bowl and it was full of pasta sauce, tomato sauce, it would spill out, anterior tilt. Likewise, we look at, see that there's no butt on the posterior tilt. Sometimes we say that's like old man butt. It's all tucked under, and it's like all pulled up, like he pulls up his, pulls up his belt right to, his ribs, So that posterior tilt is the pelvic basin tilting backwards. All right, so we have all these movements as well at the hip. We've got flexion of the arm, we've got flexion of the leg. We've talked about abduction and adduction. Medial rotation in the legs refers to the direction of the femur. So medially rotating that femur towards the body. You see the knees turning in. Lateral rotation, the femur turns out. Flexion and extension, abduction and adduction. So we've also covered already these movements. One more time going through. Dorsiflexion of the ankle, taking your foot off the gas. Dorsiflex your foot right now. Bring up those, what muscles do you feel working? Should be feeling those anterior lower leg muscles, right? To dorsiflex the foot. Plantar flex, pushing it down. Pushing that plantar flexion at the ankle moves the foot, pushes down that gas pedal. We've covered inversion and eversion. We flex the fingers, we can flex the toes. We extend the fingers, we can extend the toes. All right, good. Now we're getting into some systems of the body. I want to just review a few systems of the body because we look at later on in class, not today, but later in the benefits and physiological effects of massage. We look at these different systems of the body. Let's share that right after, Charla. Actually, let's share that right now. Charla says a great way to remember anterior pelvic tilt is to mind your P's and Q's for the muscles, psoas, quads, quadratus lumborum. So those are the mind your P's and Q's. Good. Those are the muscles that affect the anterior pelvic tilt. Are the psoas, the ellipsoas, the psoas, the quads, and the quadratus lumborum. So if you don't know where the quadratus lumborum is, go ahead and look it up. Yeah. All right. So in the bones, the skeletal system of the body are the bones of the body. We're going to talk specifically about joints today. A reminder on what the joints are and where they are. There's 206 bones in the body. You don't need to know them all. You need to know the big ones. So you don't need to know all the bones of the hands, all the bones of the feet. In fact, take a look. There's 54 bones in the hands, and there's 52 in the feet. You don't need to know all those. They're mostly tarsals, metatarsals, carpals, metacarpals, phalanges. That's what you do need to know, the general category. There's over half of the bones in our body. are in our hands and feet. Woo, that's a lot. So we have time to just talk about, like, say, the humerus, radius and ulna, femur, tib, fib. We've got the iliums here, the hips. And next slide is our skeletal system talks about our axial skeleton. So see here in this red, kind of red color, brown color, that's our axial skeleton. In the next slide, you see our appendicular skeleton in that same color. The axial skeleton is our skull, its spine, rib cage. That's all part of the axial skeleton. The appendicular skeleton is the extremities. So that includes our hips, actually. The appendicular skeleton does include the hips and the extremities. But the rib cage is a part of the axial. The hips, the bones of the hips here, pelvis is the appendicular, it's part of the appendicular. All right, before we get to dissecting our questions, we're going to talk about the different types of joints and a couple other systems of the body. So we have 6 types of joints that it's good to know. And why is it good to know that? It's good to know that because when range of motion is compromised, then we need to know what direction those joints normally move. So we're talking specifically about each of these: the ball and socket, the ellipsoidal, the hinge joint, the saddle joint, gliding joints, and then the pivot joint. Ball and socket. We've got 2 great examples here, the shoulder and the hip. So the shoulder, and it's just like if you do this with your hands. So you've got the ball, right? And then you've got the socket that goes around it. So our shoulder is a very loose ball and socket joint. It has a lot of muscles that hold it in place, compared to the hip joint, which is a really solid, you don't hear as much about people dislocating a hip as you do dislocating a shoulder. And see, it's a lot tighter with the hip, and that's a ball and socket joint. The hinge joint is just like the hinges on your cabinets in the kitchen. It actually works just like that hinge. So we have an example here of the elbow. Going next to the ellipsoidal joint. The ellipsoidal joint is found in the wrist and the ankle, the wrist and the ankles, and it's shaped like an ellipsis. So this is the shape of the ellipsis, this kind of funky circle. It's a long circle, almost like an egg, but it allows movement forward and back and side to side. And it sounds like it wants to glide, but it's not a gliding joint. It's an ellipsoidal joint. Let's move to the saddle, and then we'll move to the gliding joint. So the saddle joint is found in your thumb, and it allows for movement forward, back, up, and down. And it's in a little, it's like a saddle. It's like you're riding in a saddle. That's how it actually moves. One of the most common saddle joints is right here in the thumb. A lovely place to work if you're doing massage. Don't forget about the hands and the wrist, right? Oh, don't just glide over those puppies. Don't just glide over feet and ankles. Not after you graduate from this class. Remember, specific to be terrific. Specific to be terrific means that at some point in your massage, you get specific. And that client is going to think that massage is terrific. So I love to get specific right here on this part of the thumb. Ooh, it's so nice, right where that saddle joint comes in. Ooh, it feels so good. Yeah, so little sidebar there. Let's move to gliding joints. So these gliding joints are flat surfaces. Let me show you this slide. It's a little bit better. So they glide back and forth. And these are small movements, and they stay in the same plane. So you'll see an example of the wrist, the ankle, and then also the acromioclavicular joint. So the don't worry about that one. But those gliding joints are small, flat, and stay in the same plane. Quick review of where these joints are located. We'll start here. Oh, we didn't do pivot. The pivot joint is between C1 and C2. So right, not at the occiput. So the occiput is the base of your skull, right? But C1 and C2. So the axial, I don't remember. But C1 and C2 act like a pivot joint. You'll see there is this type of a movement. It allows us to rotate the head. Move to the hinge joint in the elbow, the saddle joint in the thumb. We've got a plantar joint right here between the tarsal bones. Moving around the radius and the carpals of the wrist right here. That's where that ellipsoidal joint is. So ellipsoidal joints have more planes of movement than the gliding joints. And then we've got that ball and socket. Got one more slide on this, and you can see it's color-coded. I'll leave this up for a moment. Oh, the atlas and the axis, that's what it is. Oh, were you guys telling me that in here? Okay. Hinge allows for flexion and extension, correct. That's right. And a hinge joint opposition. I don't know. Those aren't hinge joints in our fingers. I'll have to look into that. We got, all right, so the atlas and the axis is that pivot joint. We've got, oh, and you can see the colors here, right? Pivot. So condyloid is also called ellipsoidal. So purple, the saddle joint. The only place that saddle joint is that base of the thumb, right? So hinge joint at the knee, the ankle. So our intercarpal joints are actually gliding. Yeah. So subtalar. Yeah. So kind of cool, huh? Again, condyloid is also just another word for ellipsoidal. New words today, right? Lots of new words. All right, do we have time? We do. All right, let's cruise through the muscular system and a couple other things. So the muscular system, that's why you went to massage school, right? To work on muscles. We have over 600 muscles in our body. We have 3 types of muscles, skeletal, cardiac, and smooth. So skeletal muscles move bones, and cardiac and smooth muscles are involuntary. So they control like our cardiac muscle pumps. We don't have to think about beating our heart. Smooth muscles help us digest food. So skeletal muscles are the only ones that are voluntary. The other 2 are involuntary. Let's see, lots of different muscles here. You don't, like I said, need to know all 600. Our muscles support our skeletal system, so help us with our posture, and also help with different systems of our body. I mentioned peristalsis, which is digestion, and also the beating of the heart. Tendons connect our muscles to bones. Ligaments connect bones to bones. Our cardiovascular system is part of our anatomy, and you'll see it highlighted here. So we've got the heart, clicker, the heart. We've got all of our veins and arteries. So the abdominal aorta is this puppy right here. And we've got veins, arteries, capillaries, all part of the cardiovascular system. This pumps blood through our body, allowing our cells to get oxygen. So blood is what is used to transport oxygen to the body. And blood also removes waste from the body. Two types of blood cells, red and white. We sometimes, though, hear about blue blood, right? What is blue blood? Blue blood refers to when we are deoxygenated, we sometimes have a blue appearance, or if you're cold, sometimes your lips will get blue. Blue blood is deoxygenated blood, deoxygenated blood. And that is blood that is full of waste. We hear about lactic acid, but there's lots of different waste that the body produces. There's uric acid, responsible for gout. There's lactic acid, there's carbon dioxide, all sorts of things that are removed. And that's how the waste, one way the waste leaves our body. So this is blue blood coming back. An example of blue blood, the path of blue blood coming back from our body. Varicose veins are a part of the cardiovascular system. They're enlarged veins. They're veins where the valve has failed. It is a contraindication to work directly on varicose veins. Deep vein thrombosis also affects the cardiovascular system, DVT, deep vein thrombosis, and that is a clot inside a vein that can be caused from a sedentary lifestyle. It can be caused by certain medications. It can be caused from a long plane ride for a person who has a tendency to clot. Sometimes people have a DVT and they take medicine for it to break it up. But again, that's why it is a contraindication to work directly on varicose veins, because sometimes there can be some clots in there and we don't want to jiggle those loose. Nervous system is another system in our anatomy, and that consists of our nerves, our spinal cord and our nerves. We have a central nervous system and a peripheral nervous system. Central nervous system, spinal cord and brain. Peripheral nervous system, everything outside of that. The lymphatic system, sometimes it's called the immune system, but the lymphatic system contributes greatly towards our immunity. You'll see we cover these systems in more depth in the online learning center, but I just want you to be aware that the lymphatic system, these are the organs of we've talked about our lymph nodes, our lymph ducts, right? This system helps our body fight infection. We have our spleen is a part of that, our thymus, not our thyroid, our thymus, which is located here. And also bone marrow is a part of our lymphatic system. All right, so let's summarize the different other different systems of the body. We talked about skeletal, muscular, cardiovascular, nervous, and lymphatic. And then there's 7 systems we did not talk about, and that we'll talk about in another lesson, but you can see them here. That's the digestive, respiratory, integumentary, the reproductive system, and the urinary system, or the excretory system. We spend a lot of time on these systems of the body when we talk about the benefits of massage. We cover each system of the body and the benefits of massage. All right. Where's my there's a slide here that's supposed to say dissecting questions. All right. Are you ready to dissect some questions? All right. We're going to cover a few questions that have to do with what we've just learned. So the ankle is blank to the hip. The ankle is blank to the hip. So the ankle is what to the hip, huh? All right, let's look at our answers. Inferior, medial, distal, superior. Best answer. Spoiler alert, there's 2 right answers in this question. Ooh, 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 ooh. All right, we're going to get to the best answer. Okay, and the best answer might be subjective. It might be my best answer, but it might not be your best answer. The ankle is blank to the hip. So dissecting questions, we're asking about the ankle and we're asking about the hip. Can you get rid of 2 wrong answers? Test taking strategy, get rid of 2 wrong answers. Is the ankle medial to the hip? An anatomical position. It is not medial to the hip. Is the ankle superior to the hip? It is not. So we know those 2 are incorrect. Make your best guess. Is the ankle inferior to the hip or is the ankle distal to the hip? And I hear you out there saying, Jody, they're both right. They're both right. What's the best answer? Good. Yes, 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 you guys. Yes. The correct answer, the best answer is distal. It is the proper terminology. If you are talking about taking the MLEX, if you are talking to a doctor, if you are talking to a nurse, if you are talking to a physical therapist, the ankle is distal to the hip. It is also inferior, right? It is. It's lower than the hip. In anatomical position, the ankle's lower than the hip. But the best answer is distal. All right. The blank plane divides the body into upper and lower sections. The blank plane. All right. So we're talking about a plane of the body. We're talking about upper and lower, not left and right, not front and back. Can you eliminate one or more of those answers? Answers we have in front of us are transverse plane, frontal plane, coronal plane, sagittal plane. We didn't even talk about the coronal plane today. All right. The blank plane divides, okay. So upper and lower. Which one of those do you want to get rid of? What do you know is wrong? What is your memory tools? Yes, D is wrong. Yes, D is wrong because sagittal, right? You're sitting in the saddle. That's left and right. Frontal, front and back. Good. B and D are wrong. You are correct. All right. Let's make your best guess. A or C? The blank plane divides the body into upper and lower sections. The transverse plane. Yes, the transverse plane. And Lynn, did you find an answer to your question on what is another name for the transverse plane? We'll talk about that at the end. Let's do one more question. All right. Yay, we're finishing on time. I was worried about running over. Okay, in Western anatomical position, the human body is blank. Ooh, all right. I threw this in there because long questions freak people out. I'm not going to have time to answer all this. We must slow down and read each of the answers. So anatomical position, right? Standing. So we're standing erect. We're facing forward. Each of the answers has standing erect, facing forward. Go ahead and put your answer in the chat. So go ahead and put your answer in the chat. We're going to eliminate, let's see, what can we eliminate? All right, facing forward, arms straight out, palms facing forward, arms at the side, palms facing forward, arms at the side, palms facing back, arms bent at the elbow, palms facing up. That is not anatomical position, right? That is maybe a yoga pose, right? Standing erect, facing forward, arms bent at the elbow, palms facing up. No. All right. So the other 3 have arms at the side. Oh, no. A has arms straight out. In anatomical position, are arms straight out? No, they are not. They are not straight out. No. All right. Let's see what we got in the chat. All right. Who's on Big's iPhone? Type your name in there. I don't remember who's on Big's iPhone. All right. Okay. So it is standing erect. All right. What do we got? Do we have answers in here? Come on now. All right. Put your best answer in there. Okay. Good. Thank you. Yes. Oh, transverse is also known as axle pine. Whoa, I don't, is that right? Okay. All right, let's answer our question. In Western anatomical position, the human body is, this is how we get all the directions of movement, right? So we are standing erect, we're facing forward, arms are at our side, and facing forward. Palms are facing forward. So pinky is towards the body, thumb is lateral, pinky is medial. Yes. All right. I know Western versus Eastern. So the question came in Western. I know it throws you off, right? What's Western? So that means in the West. So in anything that is not everything in North America is considered Western, the Western world, versus the Eastern methodology. The Eastern world is Asia, India, so that's Eastern philosophy, Eastern religions, and Western medicine, Western, um, Western medicine. So it's not that they're against each other. It's sometimes just known as Eastern and Western medicine. Um, but in Western anatomy, I know it's like why would we call it Western? We live here. But in our traditional anatomical position, it's considered Western. I don't know what it is in the East. Maybe it's the same. Yeah. All right, I think that's it. Woo, yes. Hey, what you can expect right before we close this session, what you can expect coming up in the new year. We are going to be offering, I am going to be offering classes for your first, for a year of mastery. We are going to work through 12 topics that I believe are essential in your, to know in your practice. And typically when I work with new graduates, people who are, either in their first year or their 50th year. These are some core tenets, core principles, and we're going to be talking about body work and things like how to find the psoas and how to work the QL and reciprocal muscles, but it's career development as well. So what does it mean to be an employee versus an entrepreneur, or an employee versus an independent contractor? What are the pros and cons of starting your own business? What are some good business practices when you are operating? Because in your career, you may just go to work for someone. That's awesome. I highly recommend that, by the way. I highly recommend you go to work for someone, especially when you first get licensed, just because it's easier. You don't have to think about marketing and taxes and, like policies and procedures. But what you can expect for your career development is that starting in January, I'll be sharing some of my best practices with you. Not during this time. This time is going to stay MBLEX review course. But on Tuesdays, we're going to add back the class Tuesdays at noon, and that will be specifically for a year of mastery. A year of mastery to just plug in to other people who plug in with other licensed massage therapists who are either thinking about doing their own business, maybe doing their own business, but also just to have some of that additional learning. You may have got some of this in school, but if you went through a 6-month program, a lot of this stuff you didn't get. And you'll get it later in your continuing education life. But I'm going to join you and give you some of my best stuff on Tuesdays for your career development. All right. Great work today. You hung in there through a yucky subject. I guess it's not yucky. Anatomy and physiology. You hung in there, making sure that you had what you needed to tackle the MBLEX. This particular recording will be, I can tell that after we stop the recording. So let me just sign off by saying thank you so much for hanging in there. Thank you so much for your beautiful commitment, your beautiful desire to be a licensed massage therapist. I have friends who tell me, oh, I don't know what I want to do with my life. Some people say, I don't know what God's will is for my life. I'm so confused. If you're listening to this class, one of the desires of your heart is to be a licensed massage therapist. And guess what? The desires of your heart is God's will for your life. It is the universe's will for your life. It's the universe calling to you. Calling to you. Whether you do this full-time, part-time, or for family and friends. This is a call that comes from deep inside you. And so I thank you for listening to the call of your heart. Talk again soon.